When multiple medications weren't working, Rick Carlson underwent an innovative procedure to get his high blood pressure under control. That procedure involved his kidneys. We show you the connection between hypertension and your kidneys and the fix that has Rick back in the driver's seat. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. The American Heart Association is introducing new high blood pressure guidelines with the focus on early intervention with medicine. We will show you those changes. And along those lines, did you know that more than 40% of Americans have high blood pressure or hypertension? Hypertension increases your risk of a heart attack, along with a host of other problems. And when medication wasn't fixing Rick Carlson's hypertension, doctors targeted his kidneys with a minimally invasive procedure.
This is a '69 Cadillac Coupe de Ville.
If you can't find Rick Carlson, the first place you should look
I love old cars.
is his family's classic car garage in Tonganoxie.
47 Packard Clipper, 72 Le Mans, 92 Corvette, 69 Corvette. Now that I'm retired, I've got time to go back and start again and relive my youth.
Restoring old cars to their former glory is his labor of love. And these days, Rick feels a bit like he got refurbished.
I feel the best I've felt in 40 years. Since I've had my surgery, I've had a new lease on life.
For years, he says, he was on 6 different blood pressure medications just to keep him from having a stroke.
It was damaging my kidneys, so I had to get off of some of them.
And that's how he wound up seeing University of Kansas Health System cardiologist Dr. Kamal Gupta, co-director of the health system's hypertension program.
He was a very, very enjoyable man, but he was a straight shooter. You know, I mean, he told you just exactly what could happen.
Dr. Gupta told Rick he was a prime candidate for a relatively new and minimally invasive procedure called renal denervation. Because kidneys play an integral role in regulating blood pressure, renal denervation, which is burning or ablating the nerves around the kidneys with radiofrequency, could permanently lower Rick's blood pressure. Dr. Gupta and his team would be able to reach Rick's renal arteries by inserting a small tube into his leg and weaving it up to the kidneys. Rick had never heard anything like it, but he trusted Dr. Gupta and decided to go for it. And boy, has it paid off.
When I woke up, no pain whatsoever. I mean, it's like I'd never even had it. I felt an instant difference within a week.
Even better, he's down from 6 medications to 2, and the dosages are almost half of what they used to be.
I've got a lot more energy. I don't even think about it. I just get up, get dressed, and go do whatever I need to do.
More energy, giving him more hours in the day to do what he loves most. And Rick says his next goal is to one day coax Dr. Gupta out to Tonganoxie so Rick can take him for a spin in one of these beauties.
I owe him a new lease on life. I really do. And I tell him that every time I see him, so.
That is so nice. Rick, we're so glad you're here. Which ride did you take here?
I didn't take any of my old cars.
Boo! We wanted to go for a spin in those.
I didn't bring one of my old cars.
Next time. Rick joins us in studio along with 2 very important guests. We have cardiologist Dr. Kamal Gupta, and we are also pleased to welcome nephrologist Dr. Sri Yarlagadda. Both doctors are co-directors of the health system's hypertension program. Thank you for taking time out of your busy schedules to be here. We know you have been working right up to the last moment with your laptop. Rick, how are you feeling today?
I feel wonderful.
Do you still have that boost in energy?
Oh yes, every day.
It's remarkable. Dr. Gupta, right out of the gate, can you explain, and you brought a prop with us, we love props, how the kidneys play a role in managing blood pressure?
So, unlike what a lot of people think, it's not the heart that controls blood pressure. It's the nexus between the brain and the kidneys. Mm-hmm. So I would think of kidneys as like a thermostat for the body. it will it's set at a certain normal level. In those with hypertension, the thermostat is set high. So when the blood pressure is high, the kidneys are still thinking that it's not normal. It's normal. And so they let it be. And then they tell the brains, and by the nerves working with each other, the blood pressure stays high. So we can, even the medicines we use to control blood pressure, many of them work through the kidneys to bring the blood pressure down and reset the thermostat.
That is fascinating, and that's one of the best explanations I've ever heard, because everybody understands the war of the thermostats at home, and you got to get that temperature just right. Which brings in Dr. Yarlagadda. As a nephrologist, you specialize entirely in kidney function. Rick says some of the medications he was taking were starting to affect his kidneys in a negative way. Is that common?
It is not common, quite uncommon for kidneys to affect blood pressure, but uncontrolled hypertension or high blood pressure, which results as not taking medications, can affect kidney function, and often it gets confused as to some medications may cause kidney problems. Okay, so
is it kind of like the chicken and the egg? What came first?
Right.
Okay, well that explains
the blood pressure itself affects the kidney function, not the medications.
So for people watching, how do they know what medications to take, how many to take? Is it ever too many?
Whatever it takes to get the blood pressure under control. What we do know is uncontrolled blood pressure has consequences, and the earlier you address it, the better. Less damage to your organs.
I want to get to this procedure because the procedure is so cool. Is this only for extreme cases that you perform the procedure on the kidneys?
Yeah, so as Dr. Yarlagadda said, that the goal is to get the blood pressure under control, because over years and decades in a person's life, high blood pressure will affect the brain, affect the heart, affect the kidneys, and it is one of the commonest causes of stroke, heart failure, heart attacks, and death in America by a very large percentage. So in most patients, we can get a good control, good lifelong control of blood pressure with 1, 2, 3 medicines. Mm-hmm. But there are certain patients, maybe up to 15-20% of people, where even after 3 + 4 medicines, blood pressure is not controlled, or some people have side effects with medications they can't tolerate. In those patients, this is a procedure that is now available that we can offer if the patient is suited for that.
And Rick, I want to ask you, what were your symptoms that you were having trouble with your hypertension, and did you feel it in your kidneys?
Well, not so much the kidneys to start with, but I would get severe headaches, and I could tell then my blood pressure was starting to rise, so I continually took my blood pressure to monitor it, and sometimes it would get up over 200.
Oh my goodness.
And where they found that my kidneys were starting to be affected was during my blood work. Mm-hmm. When I do my blood work, then they could see some effects to my kidneys in that aspect.
Got it. What is so great about this program and special is that it's a collaboration, which is why we have a nephrologist and a cardiologist on this show together, because Dr. Gupta and Dr. Yarlagadda work very close with each other. So would you recommend, Dr. Yarlagadda, anyone who's seeing a nephrologist also see a cardiologist, or vice versa?
I'd also like to state that vast majority of patients or people with high blood pressure do not need a cardiologist or a nephrologist managing their blood pressure. Primary care physicians are very well trained and equipped to treat blood pressure, and if it's controlled with 1 or 2 medications and they're tolerating it well, they do not need to see a cardiologist or a nephrologist. If they do need an opinion and feel that they can benefit by seeing a specialist, both are equally trained to treat hypertension, and to reduce redundancy, seeing one physician is enough. And programs like us, we always consult with each other when we're in doubt, if we have a complex situation.
And so, Dr. Gupta, would Rick be a complex situation?
Yeah, because he was on 5 medicines, and the blood pressure became the overriding concern in his life. He was checking it regularly. There were headaches, and when the blood pressure is not controlled, even if it's over 150 continuously, then it becomes a life-threatening issue in the short and long term. So yeah.
And Rick's a busy guy. Nothing, you can't stop going.
Yes.
You've got cars to remodel and refurbish, things to do. Is there something about Rick's genetic makeup that would make his blood pressure such a tricky thing to handle?
So hypertension is what we call a multifactorial disease. There's a huge lifestyle component, aging component to it, salt plays a role, but hypertension runs in families. There's a ethnicity issue, and some families have hypertension early. But in Rick's case, I think it's the hypertension that a lot of us get, and sometimes it's difficult to control. Mm-hmm. So I don't think it's a genetic issue per se. Yeah.
Rick, this procedure that Dr. Gupta did is a relatively newly FDA-approved procedure. Did you have any reservations?
Not any at all. I mean, when they referred me to Dr. Gupta, he told me what they were going to do. It explained that it was a new procedure, that it hadn't been done too often, and I said that I have full faith in you. Let's get it done as rapidly as we can, and within a week and a half, I was in and out.
That's fantastic.
Finished.
And Dr. Yarlagadda, are you also in the procedure room alongside, or Dr. Yarlagadda, are you alongside Dr. Gupta when this is happening?
I am not.
Okay. So you guys consult, and then when it's time for the procedure, it's Dr. Gupta and his team. Mm-hmm. And we have some great video of Dr. Gupta performing this very procedure. It's on another patient, not Rick. Dr. Gupta, how often do you perform these procedures, renal denervation?
So it's a relatively new procedure.
How new is it?
It was approved by the FDA in November 2023.
Okay, very new.
Yeah, and so it's been a year and a half. And there are significant insurance restrictions to it, which are getting worse. So we were fortunate that, in Rick's case, the insurance approved it. Medicare and Medicaid approve it right now. Almost nobody else does. But we are hopeful that in October, a CMS coverage decision will come, and then I think we'll be able to offer. We have a long list of patients, both Dr. Yarlagadda and I, that need something else than medicines. And we are just waiting for insurances to get starting approval.
Oh boy, so that's the only reason there's a line.
Yeah, we have lots of patients waiting, 50 plus, yeah.
How long does the procedure itself take?
Give and take an average about 60 minutes of procedure time to 2 hours, 1 to 2 hours, yeah.
And this provided great results for Rick. Rick was saying he instantly felt better. Does it ever not work to lower blood pressure?
Yes, and we are learning. So when we talked to Rick, he was confident, but I wasn't, because he was one of our first patients, and there's data from Europe, where it has been around for 10 years, that it is very successful. On an average, it works to some degree in about 75 to 80% of people.
Okay.
In some, it works really well, as like it did here. In others, it works less well, but it is an improvement over the current state. And the thing about this renal denervation procedure is, and we don't know exactly why, but as time goes by, the blood pressure control continues to improve in many patients. So year 1, year 2, year 3, the control stays and may actually improve. But not everybody benefits, and when we offer this procedure, we want to set the expectations realistic. We say we'll learn with you in your situation how well it'll work. So we tell them it may not work at all, but it may work really well. So about 75% of the times it works. And the one thing we know, it's very safe.
Mm-hmm. Yeah. We're going to get into exactly how this procedure works. It's very interesting. First, we're going to show you some videos on your screen and illustrations, then we'll get to the show and tell.
Sure.
This first one, it talks about what you use to reach the kidneys through this tube in the leg. Now, where does the tube enter the leg?
So we go from the groin.
Okay.
Those who've had a heart catheterization are familiar with it. So we find an artery in the groin. Hopefully we'll be able to do it from the wrist, and we slide a catheter up from the groin through the arteries, which all connect up to the kidneys.
Okay, then you reach the kidneys, and then we have a better look at that catheter in, I think it's in the screen behind us. Okay, so there are these electrodes on that, those gold bands.
Yes, yes.
Why do you need 4?
So because the renal arteries are quite long and there are multiple branches, and the first generation actually only had 1 electrode.
Oh.
So the procedure took a long time. There was a lot of manipulation. So now we can put 4 ablation points at one time.
And the procedure also monitors the temperatures of those electrodes. Why is that important?
Yeah, so it is connected to a smart computer which checks the temperature, checks what is called an impedance of how the current is flowing into the artery, because we don't want to cause injury to any other structure except the nerves.
Can we show the demonstration you brought here? If you can hold that up.
Yeah, so
we love when doctors bring.
I'm going to first show you, this is a real catheter. This is what we use.
Let's hold it up so they can
so,
zoom in there.
As you can see, this is a catheter that is curled, so it fits the artery really well, and we can turn it, we can push it.
Put it over to your right more, so it's in front of the red. Okay, so there you see.
Right here. So this is a catheter.
Okay, that's tinier than I thought.
Yeah, because the kidney arteries are just 1/2 centimeter wide.
Okay.
So, and then we kind of straighten it over a wire, so it kind of straightens out.
And let's angle that a little to the right, just because your white coat, it's kind
Okay,
of
right there.
that way.
That way.
There
Okay,
we go.
so it's straightened out, and then now we can advance it into the kidneys. So there's a model here, and I'm going to do it.
I'm going to borrow your coffee cup, bring it over here, and let's hold that up a little.
All right, so let me first advance it,
Okay.
and then we kind of do this.
So that would be it going through the leg till you reach the kidneys.
Yes.
Okay.
So we kind of go there, and the wire goes out quite a bit. So if we can show this here.
Okay. A second.
There.
Okay.
So if you zoom on to this kidney, our catheter is right in there.
Okay.
And then we'll pull the wire back. If you can hold this for me a little bit.
Sure. Okay,
Yeah.
hold on.
Yeah.
And props to the control room for rolling with us on this.
Yeah. So when we pull the wire back, the catheter kind of shapes it right here.
And you know, because you're looking at a screen.
We are looking at an
where it
X-ray.
is. Okay.
And the catheter, the dots that you showed on the screen are radio opaque. You can see them.
Okay.
So we go into every branch. We have tools where we can finesse which artery we go into. The key is to really do a complete job, because you have to go into every branch of the kidney artery, and sometimes there are 5, 6 branches.
And are these branches the
Yeah,
clear?
the arteries are like a tree. The kidney arteries are like a tree.
Okay.
As a tree has multiple branches, so do these arteries, because they go to the whole kidney right here. So we got to go into every branch, and if the physician does not do a complete job, because it takes time and finesse, and once we do a complete job, then we are confident that we have taken care of most of the nerves that may connect to the brain to cause high blood pressure.
Can I touch the?
Yes.
So this, I just want to see what this feels like. So it just feels like a wire.
It is
like a Christmas tree.
That's
light
exactly
wire.
right. It's very flimsy,
And then
so it's safe.
The gold, you can barely see those 4 gold.
Yeah.
What were those called? The electrodes?
Electrodes, correct.
Those 4
yeah.
gold electrodes you can barely see, so it's super tiny.
Yeah.
Does anything ever, and we can put this down
Yes.
now, does anything ever, is there a risk to any of the other body parts or areas of on the way up and when you're doing that?
Yes, so there's a risk that you may damage the artery from the groin where you go up. There's a risk that you may damage the artery to the kidney, shut it down, cause clots, cracks. Those risks are real. But all the risks together, in lots of studies done in Europe and the USA, are much less than 1%. And we've done a handful of these, I think, low double digits, and we've had no complication at all.
And Rick, you had no fear. You said you took one look at Dr. Gupta and you said, sign me up.
Well, life is a big risk, so I mean, I was at the end of my risks, so I had to rely on Dr. Gupta, and I had complete confidence in him.
Good choice.
Once I met with him the first time, he explained exactly what was going to happen, and I wasn't worried in the least.
Go on.
I
sorry.
just told him, let's hurry up and get it done. And he did.
Get her done.
And he did.
We have some great questions coming in and some great comments. So if you have a question or a comment that you would like us to read out loud on the program, you can send it to us right now. You can connect with us in real time on Facebook, the All Things Heart email, or YouTube, and all the ways you can connect with us right now are right there on your screen. Rick, what was the recovery process like?
I had to start the procedure done and walked out. I mean, there was no recovery to it. I mean, I took it easy one day just because of the incision in my groin, but from then on, I was back to normal daily work procedures, as far as what I do,
Is the patient totally asleep for the procedure, or is it a twilight?
It's a twilight zone. The procedure causes pain when we do the ablation.
Okay.
But patients don't remember it because of the medicines we give them. They're awake, they're breathing on their own, and when they reach the room, they're a little groggy, but within 10 minutes they're up and they don't remember anything, which is kind of amazing and good.
That's great.
Yeah.
What's the last thing you remember before you went?
Getting wheeled into the operation room.
Perfect. So before renal denervation, what options would Rick have had?
I think both Dr. Yarlagan and I know that we just have these medicines. We have about 10 kinds of medicines that we work with.
And do you start out, Dr. Yarlagada, just one or two, and then keep trying, adding?
Yeah, it's all about tailoring the medication regimen to the patient. You find the match and then whatever it takes to get the blood pressure down.
I want to talk a little bit about the health threats from high blood pressure, because many of them you would expect, like stroke, heart failure, heart attack, but high blood pressure or hypertension can also cause vision loss, kidney disease, kidney failure, and sexual dysfunction. Dr. Yarlagada, how does high blood pressure affect your vision?
So the eyes have arteries or blood vessels that are very similar to the kidneys, and high blood pressure leads to damage of these blood vessels, thereby leading to loss of vision. We call it hypertensive retinopathy. Similarly, they can affect the kidneys by the blood vessels and lead to loss of kidney function, thereby leading to kidney failure.
How would something wrong with your kidneys, high blood pressure, affect sexual function?
High blood pressure, even without causing kidney damage, is known to affect sexual function. It can affect libido, it can affect orgasms, it can affect it can cause erectile dysfunction.
I think a lot of people will be surprised to learn that, because they just associate high blood pressure with those top three we mentioned having to do with the heart. The American Heart Association, in fact, just released some new high blood pressure guidelines. This is the first major update since 2017. And in these new guidelines, the experts now urge treatment earlier. That means lifestyle changes, number one, and beginning medication earlier. And the update also recommends new medications like GLP-1s for some patients. Dr. Yarlagada, I'll start with you. What are your thoughts on these new recommendations?
The new recommendations are good and long overdue. I'm glad we have them. I like the emphasis on earlier control. But in regards to, it's all about picking the right medication for the right patient.
Dr. Gupta, what about you? What are your thoughts on those new guidelines?
I think they are an improvement on the previous ones. They recognize that high blood pressure remains the leading cause of stroke and heart failure and death, and they want physicians and patients to work together. It's a very important component of the new guidelines is shared decision making, because as Rick knows, being on 4 or 5 medicines they have side effects, so you got to be continuously working together. And they do talk about lifestyle changes, and GLP-1s are important because weight loss really helps control blood pressure.
Okay.
Yeah.
That was my next question, was the GLP-1 factor.
Yeah.
So controlling your weight would help control your blood pressure.
Correct.
We have some great questions and comments from our viewers. I want to dive right in with Jeremy Yentz. Jeremy writes, The nerves near the kidneys that are being zapped by this procedure, are they specifically for any one thing, excuse me, like stress hormones or controlling how you handle salt or anything?
So very good question. When the procedure was first envisioned almost 20 plus years ago, that was a big concern, that all nerves have a purpose in the body. And these nerves, while they are very active in managing blood pressure, what if we went overboard? Will the heart rate drop too much? Will the patients not be able to raise their blood pressure or heart rate when they need to, when you exercise? So the good news is that detailed studies and research in patients who had denervation showed that when you exercise, your blood pressure does rise appropriately, your heart rate does rise appropriately. You don't get dizzy when you get up. So I think the safety of the procedure has been demonstrated again and again. Yeah.
Joshua wants to know if Rick will ever have to undergo this procedure again.
So that's an easy answer. The data suggests that if it works, if it's done correctly, if the physician is taking their time to going into each branch, then this procedure should not be repeated.
Denise wants to know about the ablation process. Denise asks, how do you know when to use freezing or burning?
So that's a good question. The most commonly used device, the one I showed, does heat energy, electrical heat energy. There are other devices that are in trials, and so there are 2 approved products in the United States right now. One of them, the one that is most well studied, is this one. There's another product that is a balloon that doesn't cause heat energy. It causes ultrasound energy to do that. Yeah.
Jean asked, she's got another great question. What did you do before ablation? Did you just have to cut things out?
So there is no cutting. There is a procedure that has fallen out of repute decades ago where the surgeon went in and disconnected the nerves in the spine. But that was extremely morbid procedure with lots of side effects. So if before this procedure, it was lifestyle medications.
Okay. And then Teresa wants to know, could this be used, I think you've already answered this, could this be used on people newly diagnosed with hypertension before medications? But Dr. Yarlagadda, you would say?
Yeah, this is for more complex hypertension and not newly diagnosed hypertension who hasn't even tried meds.
This is not something to be tried if there's other things first.
Oh, yeah.
This is if nothing else is working.
Correct.
We have 2 viewer questions for Rick about cars. Oh. Buckle up, Rick. Okay, Marie wants to know, what's the oldest car you've ever restored?
Probably the 1936.
And what was the name of that one?
It was a Chevy 5-window coupe.
And John has a question. He wants to know if you sell them after you restore them, or if you are a car collector.
No, I'm a collector. Once they reach my collection, that's where they stay.
And how you just keep collecting? Do you ever have to get a bigger and bigger garage?
Bigger building if I have to. And the thing is it's my son's inheritance. Mm-hmm. He likes the old cars too, so we work together in the shop, and so what I collect, it eventually going to trickle down to him.
Yeah.
And doctors, are you going to take a trip out to Tonganoxie to go for a spin?
I'm going to take him up on the offer.
Okay, that sounds fun.
I'd love to have you.
Can we please have pictures of you driving around? Dr. Yarlagadda, are you going to?
I'm a novice. He has to explain to me what those cars are. I wouldn't understand.
I think you just have to sit down and buckle your seatbelt, and he'll do
that.
The
I can do.
That's what you do.
Real quick, Becca wants to know, do you know your blood pressure today? What is it? Not like at this minute, but as when you take
I've been running about in the high 130s.
Okay.
And that seems to be a good range for me. My body functions between the high 130s and very low 140s. And that seems where I have the most energy.
Doctors, you're nodding your heads. It sounds pretty good to you.
Yeah, compared to where he was, it's really good. Yeah.
Better than over 200,
yes.
Which sounds scary. So glad that you're doing well. Before we close out, I want to get to some final thoughts. But first, doctors, I want to share something that Rick said about his experience of being treated here.
I transferred all of my medical. They've got all the doctors that an old person like me needs, all in one group. And they all talk to each other. They all, you have your charts that they can pull up, and
one-stop shop.
It's one stop, yeah. And it's wonderful.
One-stop shopping. That's what we like to hear.
That's what it is, one-stop shopping.
Rick, thank you so much for sharing your journey with us.
Well, I got to thank the doctors.
No, thank you.
I really got to thank the doctors, because I might not even be here if I was beginning to be worried about it. So.
And now you have your life back and that time with your son.
Now I can enjoy the last few years I have left. So.
Well, hopefully it's more than a few. You look very young. I know you call yourself an old guy. You don't look like an old guy.
Well, I'm old. I'm in 72, so
you look
that's
amazing.
pretty old.
A lot of people who are in their 70s are watching saying, what? No. Dr. Gupta, or Dr. Yarlagadda, I'll start with you. What do you want our viewers to know?
Reviewers, I want the viewers to know that high blood pressure is a very common condition. It can be treated, and there are consequences to untreated blood pressure.
Dr. Gupta, what are your final thoughts?
Most patients with high blood pressure don't need me or Dr. Yarlagadda. They need to watch their diet, salt, and work with their primary care. But when blood pressure is poorly controlled, we do what Rick may not know is we did a battery of tests. I reached out to Dr. Graves in endocrinology, Dr. Yarlagadda in nephrology, to make sure that this was the right procedure. So we have a team, as you said, in KU. We work very closely together. And this is not a procedure that anybody should do without extreme due diligence. Mm-hmm. Yeah.
Thank you very much for taking time to be here. We really appreciate everyone coming on to share and join in this discussion. And thank you so much to our viewers for being here today and sending in your comments and your questions. Coming up next week on All Things Heart, a tiny lump grows into a lifetime of complications.
The lump went from a knot like that to a baseball.
From delayed cancer treatment to heart failure to living with an LVAD and multiple cancer diagnoses, John Hill keeps going thanks to stellar care and a special bond that inspires him. That's coming up next week on All Things Heart.
Coming up tomorrow on the Morning Medical Update. Prostate cancer is one of the most common types of cancer. There are numerous choices for patients. I'm Jessica Lovell on the next Morning Medical Update. Radiation is one route, and now some patients at the University of Kansas Cancer Center can undergo all treatments in just 1 week. That's Friday at 8.